So we are already on all set, being told from the control room. So let's get started, everyone, on the conversation. I have my guest here in Lagos and our Abuja studio, Mr. Jide Ojo in our Abuja studio, and Dr. Babatunde Ipaye. Thank you so much, gentlemen, for coming on tonight. What we'll be discussing is perhaps the very depressing projections coming out of the COVID-19 situation in Nigeria. The Lagos State government today says is forecasting that cases of COVID-19 in the state may increase to 120,000 by July. That's about a month away from here. But the state also said it will likely commence hydroxychloroquine trials in about a week, as the state is currently manufacturing sample collection kits and is working to get more test reagents. Well, in Kogi State, there is perhaps a more dramatic situation in that side of the country when the governor, Ipaye Bello, ordered a delegation of officials of the National Center for Disease Control, NCDC, to be quarantined at the state isolation center for 14 days. Well, those people that have been asked to be quarantined are the members of the rapid response team who were deployed to Kogi State to ascertain the true status of the state as a COVID-19 free state. Governor Bello, however, directed that they should be isolated before they can take the sample of any resident of the state. He says that is in line of the procedure of managing COVID-19. Let's get to it, everyone. Let's my guest jump on the issues. Thank you so much, Dr. Ipaye, for joining us. You are an expert in this kind of case. When Lagos State says 120,000 in another 1 month, yesterday we saw Lagos State having almost 200 cases. So when they're projecting 120,000 cases before the end of the month, is that scary enough?
Yeah, it's scary, but it's not impossible. It's a projection. And of course, Lagos State has been extremely proactive, of course, about the most proactive state in terms of case finding. And the community case detection of Lagos State government has produced significant results that way, you are saying. And for a government that is this proactive, and you're looking at a population of over 25 million people, okay, it is not unlikely to have that kind of number, especially now that we have community transmission. You know, when I came on set, sometimes in March, 29th of March, I said, we need to be very smart. We need to be ahead of this virus. Unfortunately, Nigeria was not ahead of the virus. And we have allowed community-level transmission. And at that level, you're going to see hundreds of thousands of cases. Well, two things. First, it was a bit late to lock. Okay, we didn't lock down on time. Second, testing was not adequate. Of course, if testing was adequate, you can't properly map the COVID virus if you don't do tests as you need to do. Of course, NCDC started scaling up a bit late. Of course, now we need to think out of the box. And we actually need to begin to look at alternate testing methodology that's affordable, that will rapidly give us results, that will make the country and the control system be a bit ahead of the virus. If the virus travels ahead of the response, they will be chasing it. Of course, if you look at countries that have been able to contain this virus, it's because they're able to test as many people as possible. If you don't test a great number of people, where do you know the virus is? How will you isolate people that are transmitting virus? And so, I mean, kudos to the government of Lagos, no doubt about that. And I mean, unlike in places that are celebrating absence of the virus, it's just because they have not tested people. If you test people, you pick cases. And of course, I don't want to mention to you some of the states where I've seen, deaths that cannot be accounted for, where, testing didn't start on time. And of course, even during the so-called lockdown process, you still saw hundreds of people moving across Nigeria. So these are things that we need to critically look at and take decisive action on them.
Dr. Ipaye, we just took about 3 days of some of the cases and look at the rise in the numbers. Take a look at it. Just from the 5th to yesterday, look at the cases. Reported cases was rising 148 on the 5th. On the 6th, it rose to 195. It rose then yesterday to 381. It took us from 2,000, almost 3,000. Now we are hitting 3,526. Let me go to Mr. Jide Ojo. Mr. Ojo, this SGF, with the cases that we're seeing, he said, look, there will be tougher measures. They've discussed with security chiefs and that there will be tougher measures, not punitive, but to make sure that the case is nipped in the bud. But a lot of people are criticizing that maybe we shouldn't have eased the lockdown. Your thoughts?
Well, It's impossible not to have eased the lockdown. And I think the federal government is getting it right in the sense that even the easing of the lockdown is being done gradually. All over the world, even for Britain, UK, that says last week when Boris Johnson resumed duty after being cured of COVID-19. Now they are talking of reopening the economy. The US is reopening 36 states, 34 or 36 states out of 50 by this weekend. So every other, France, Germany, we are talking of even sports resuming. The point is, Sean, we need to live with COVID-19. We cannot live outside of COVID-19. We cannot shut down the economy till COVID-19 is over. Nobody has the actual projection of when this pandemic will come to an end. So we must learn to live with it. I recall time past, when people have cholera and they die so like foul, people were like, oh, this is unheard of. When it was smallpox, everybody, because we didn't understand how the virus, how the bacteria, how all of these things work, it was killing people in their thousands. But today, we are living with cholera, we are living with meningitis, we are living with Lassa fever for over 50 years, and these are very, very deadly viruses and bacteria. So we must learn to live with COVID-19. So I will not blame the federal government. And when we say the federal government is the lockdown too early, how many states did the federal government lock down? We are talking of 2 states and Abuja. The Kano that was locked down last week made it the number 3 state out of 36. It was more in the hands of the governors. And you can see what different governors are doing in their respective states. Some saying during the Easter weekend, you can go to church. Some saying during Ramadan, where some people can go to Juma. And you are applying different measures. So I will not blame federal government. The bottom line is that we must work smart to live with this virus, understand how it spreads, and protect ourselves.
All right. So
Taiwan.
Just a moment, Mr. Ojo.
Taiwan locked.
Just a moment. We need to go on a break. Interesting the mention that you have brought up. I will come back to Dr. Ipaye so that you can react to what he has said. And we'll look at the Kogi State situation. Cross River 2 does not have a case yet. But we'll look at all of the dimension, the politics, the intrigues that have come into it, and how we can get out of this quagmire the world has found itself. We'll take a break. And when we return, more on this. Join us again.
Well, there's a difference between what the model says in terms of how many people are going to be infected and what our capacity to identify positive people is. So our model suggests that by July, we're going to see somewhere between 90 to 120,000 positive cases. However, our testing algorithm only tests for people who have developed symptoms. I said earlier that many people will catch COVID-19 and may not even know that they have it, which is why it is a virus that can spread so easily in community. If you don't know that you have it, you're not likely to present yourself for testing, and in fact, there may not be a need for you to be tested, as long as you're practicing what we describe as social distancing, respiratory etiquette, and good personal hygiene. We're using original manufacturers, and the people that have manufactured hydroxychloroquine originally, we have 3 such suppliers, have donated hydroxychloroquine for the clinical trials. We're going to be receiving thousands and thousands of tablets made by the original manufacturers of hydroxychloroquine.
Thank you so much, everyone, for staying with us. A lot of people have talked about the manner in which the United Kingdom and the United States woke up to the realities of the COVID-19. Perhaps they were not fast enough to tackle the situation. But coming to Nigeria and our situation here, a lot of people believe that our health institutions are not strong enough. Should there be an escalation of the cases in Nigeria? In fact, today, the federal government is complaining that there is shortage of bed spaces. My guest tonight, Dr. Babatunde Ipaye and Mr. Jide Ojo. Dr. Ipaye is an expert, was with the WHO at some point, and a former commissioner in Ogun State in charge of health. And Mr. Jide Ojo is a public affairs analyst. Thank you so much, gentlemen, for coming on tonight. So we'll go to issues of Kogi and perhaps Cross River State. Kogi in the sense of what happened, the event of yesterday. But let me allow you to react to what Mr. Jide Ojo said about the fact that, look, we have to unlock or ease the lockdown.
And there are two things to distill from what he has said. The first is that COVID-19 is not the same as Lassa fever, it's not the same as Ebola, because the transmission pattern is not the same. You can't get Lassa by shaking me. You can't get Lassa by going to a public place. You can't get Lassa by going to the church.
So, okay, for you as a medical practitioner, COVID-19 is the deadliest you have seen?
It is the most infectious disease in this century, when the ability to infect people cannot be compared to any infection. Because this is infection you can get innocently by not even doing anything wrong. Okay? So the problem here is that they are not, so you can't start comparing apple and orange. Okay, so we need to get that. Then the second thing we need to distill is that at the center of any economy, you need healthy human capital. Okay, you want to drive an economy, you need healthy human capital. If you don't have healthy, strong human capital,
so you are saying that
the
lockdown should have still been in place, isn't it?
If you don't want to lock down, the options are there's no silver bullet. But the option is if you don't want to lock down, then you must be ahead of the virus. So for countries, there are countries that never locked down, but they were doing tests at the rate of not less than 100,000 tests per day.
If you have the power right now, Dr. Ipaye, what would you do? Because it does look like the situation is dire right now.
So the first thing we need to do is that we need to get to test as many Nigerians as possible first. And what are the options? Of course, the present methodology we are using is to look at the PCR, which is the gold standard. But there are various rapid test kits that people are bringing forward. I'm glad that the federal government is testing some. If we're able to get them out of the laboratory and make them available for rapid testing, then we're able to test as many possible as. Then at that point, you can begin to open your economy.
So are you happy also with the hydroxychloroquine, remdesivir, part of some of the treatment measures?
Okay, whatever treatment option we have, especially hydroxychloroquine, because the option for hydroxychloroquine is that you use it very early in the infection. And for the clinical trials that have supported hydroxychloroquine, they have said it works better when you pick the cases early. So how do you pick cases early if you are not testing? So
it comes down to testing.
It comes down to testing.
So we need to go to Kogi matter now. But before we do that, I'd like to ask you, now in Nigeria, we are in a dire situation. Would you say we should shut down some of these critical areas, Kano, Jigawa, Lagos, where we are having higher cases?
If you are not able to test, you need to lock down until you are able to test. You see, I'm not saying you should lock down the entire country, the entire economy, right? But what you need to do is that once you have a situation where you are not able to map who is sick, who is transmitting, who is not transmitting, the best is to temporarily lock, okay? And then while you get ahead of testing and you're able to test as many people as possible, then you can begin to systematically ease out. Of course, you're not going to be happy losing as many. Today, I read in the newspaper that the second commissioner died in Taraba. Is that the kind of economy you want to run?
Let's do it for a minute. Mr. Ojo, the situation in Kogi State, the federal government said they will re-engage with the Kogi State governor. How do you interpret or what do you make of the situation there?
Well, it's politics at play, and incidentally, the government in Kogi State as well as the federal government belong to the same party. And we do know that the governor of Kogi State is very close to Aso Rock. So this issue should be resolved amicably. I see this in the mode of something that happened in River State over Caverton helicopter pilots and all of that. There are bound to be issues, but I think if I read that Kogi commissioner was saying that they are under pressure to declare, but if NCDC has come and they said, we want to investigate, there have been some 4 deaths at Federal Medical Center, Lokoja, within the week. Let us have, whether it's verbal autopsy they want to do or medical autopsy as is conventional autopsy, let them carry them out. I don't see why or what the government of Kogi State wants to hide or why it's insisting on quarantining the staff, NCDC staff that have come. This is not the first state that the first state
procedure.
That
the governor, just a moment, Mr. Ojo, the governor said that was a standard procedure, that they were coming from Abuja, and the procedure is that if you're coming from places where you have high cases, that you are supposed to be quarantined. Those are the grounds.
But you know that when the delegation went to Kano, after the president's speech last week, did they first quarantine the team, the NCDC and PTF team that went to Kano? This is an emergency. You have to circumvent. You cannot insist on this kind of protocol. 14 days, if there is an outbreak, within that 14 days, if there is no federal government help, the state can be awash with death and with a lot of people being sick. So I'm not saying that the necessary things should not be observed, but I think there are diplomatic ways that we can resolve this issue without necessarily eating up the polity. I really don't know if and why federal government will want to put a state under pressure to declare that it has COVID-19 if it does not have. But recall that that was the same way Kano was denying when there are alleged to be strange deaths in the neighborhood of over 150 people dying within 3 days. And the Kano state government said nothing of such happened, nothing extraordinary happened. But it was the same Kano that eventually beckoned on federal government to say, please come to our aid. We are overwhelmed. We are losing lives of people and all of that. So we need to walk that thin line of diplomacy.
All right.
And ensure that
we're out of time, obviously.
Done.
Mr. Ojo, yeah. So in 30 seconds, Dr. Ipaye, the fact that shouldn't there have been a communication between them? Should it have been that they arrived there and they said they wanted to quarantine them? Just in 30 seconds, your reaction to it.
This is very laughable. You know, the governor is supposed to be the incident commander for COVID control in the state. So it's like you are a commander in the war front, and then people have come to help you. You say, don't help us. It is unbelievable. And it is not even what you've said. That is not the normal standard. Of course, at this point, those who are coming are people who are technical experts to help you. They are not travelers. Okay, if they are travelers coming from, COVID, high COVID prevalence place, but these are technical experts. In the worst possible scenario, what I expect the governor to say, do you know your status? If you don't know your status, can you get tested? But to say you want to put them in quarantine, it's laughable.
All right.
Because these are people that have been on top of this control and are supporting every state in Nigeria. And I think, this needs to be seriously dealt with.
Dr. Babatunde Ipaye, it's good to see you again. Thank you so much for your thoughts tonight. And Mr. Jide Ojo, always a pleasure having your thoughts on some of these issues. Thank you so much for coming tonight. Well, it's Friday. It might not be your kind of Friday because there's coffee in Lagos. Some of us, we go home straight and rest and stay safe. So should you also. Thank you so much for watching, everyone. Have a wonderful evening.